I'm doing a slight countdown until my wisdom teeth removal. I'm getting my top two and my bottom two. It's been biting out, but honestly, I'm excited because I was a little nervous. I don't know why this is a year of surgery for me. I'm about to have a puffy face. I don't even know if the airport mask is gonna fit on my head. I'm scared, y'all. But pray for me. But yeah, let's get it. All right, good morning, y'all. It is officially 4 hours. 4 hours before my wisdom teeth extraction. I'm getting my top two, bottom two, all four, one go. Let's go. Smooth like butter, they said. They should just pop out. Pop out. So, I am excited to look like a chipmunk. Alright. It is extraction time. Going up the elevator. Wish me luck. I'm excited. Not really nervous. Stay tuned. Alright. So, I just completed my paperwork. Getting laughing gas, local anesthesia, and something else I forgot. But just know I'm about to be sedated. I am. I'm again. It's nice. I got gas in my mouth, and I'm not. I'm gonna go home. I'm gonna go home. I'm glad I'm not driving home. I was gonna die. She is very knowledgeable about her time. Okay. It is post. Oh my god. It is. It's not kicking in. Pressure on the areas. They're bleeding. I can taste the blood in my mouth. And finally, now my mouth is not so numb, but I'm exhausted. I wouldn't say my swelling was bad. It hurts up in my mouth a little. I like to chew. I feel like the farthest I can get. I had a glizzy, and then I had some mangoes, and then I'm drinking a shake from Brother from the grocery store. So this is my face currently. Honestly, I can't even tell, but that alone has my jaw jumping right now. So I'm gonna go iced. I have this makeshift leg sleeve headscarf combo. I'm gonna put it on my face for the next 20 minutes. And hopefully that'll help with the swelling. I think that's also what's like exacerbating the symptoms, but it's a round face, y'all. I feel like I gained 20 pounds all in my cheeks. That hurt. Don't do that. And I drank from mascara today. Drink was good, y'all. It was worth it. Okay, I had to makeshift an ice pack for my face. So this is like a leg sleeve ice pack. And I had scarf. They say the first 3 days of the worst, so day 3, puffy face, makeshift ice pack. Oh, lastly, I do want to say I feel a lot better. I can actually open my jaw now. Like, there's a little clicking noise back here. Well, not every time, but when I open my mouth. So I think that's progress. Does it hurt? I'm trying to enunciate more just so I can open my jaw, but it does hurt a little. Not as much as it did like yesterday or the day prior, so I think that's progress. All right, update. Post gym, my dentist or orthodontist. Hold on, let me do this again. Okay, post gym, my oral surgeon told me that if I'm feeling pulsating during strenuous activities, I'm doing too much. From the moment I got on that Stairmaster, I was pulsing, y'all. I was pulsing, and all I felt was boom, 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 boom. So, did I work out a little prematurely? Maybe a smidge. But you know what? It's okay. Because the show must go on. I'm going to do my saltwater irrigation. I have one more antibiotic to take today. And before I worked out, I had some Tylenol in my bag. So I took some medication. So just make sure you medicate. Like, as soon as I got into the gym, I was like, let me take my Tylenol. So hopefully, like, as I'm going, it can fade. It sure didn't. It sure didn't fade. But do I feel okay now? Slightly. Do I look okay? Slightly. It's a process. It's a marathon. It's a marathon. Good morning, beautiful people. Day 6. I did not go to the gym yesterday. I was in pain. One thing I realized is once I laid down, I guess the blood flow from my head just kind of just rushes, and it just pulsates really bad. But I did my little, research. That's why they gave it to me. Your body needs some help. Take your medicine and take your medicine. But also, how I would rate the pain out of 10, 10 being like probably the worst pain I've ever felt, and I don't even think I've ever hit a 10, like pain threshold. I would say it's a solid 7, 6, 7. I think what's really the worst part about it is it's a constant throbbing pain. Like when you think it's about to go away, it comes back and just pulse. So like for me, that's super annoying. Instead of like, okay, it would be different if they like, oh, hey, we just peeking our head through, but it's just pulsing to the point where like my temples are hurting or my head starts hurting, and I'm just like, oh my gosh. But some pro tips. It's day 6. I'm gonna medicate before I go to work, so after work I can post medicate and then go to the gym. I didn't make it to the gym. I didn't do anything I needed to do yesterday besides work, and I barely worked because I was in pain. So, pro tip: pre-medicate, take it as instructed. I have 800 milligrams of ibuprofen, which I am instructed to take 1 every 8 hours. So I'm gonna start off my day with some ibuprofen and my antibiotics that I'm almost done with. Day 6, one more day, y'all. I can't wait to be outside. Not drinking no medicine. I got pill bottles. I sound like a pharmacy. A walking pharmacy. All right, giving you guys a little change of scenery. Day 6. I want to say I took my pill early this morning. It's been roughly 9-10 hours since I took it, and just feeling a little throbbing. So I just took my second dosage of the day a few minutes ago. I have a few more antibiotics, and then after that, I'm drug free, baby. I'm drug free. But besides that, I want to say overall, would I recommend you getting your wisdom tooth removed? Let me be honest. If you're not going to do them all at once, I wouldn't want to go through this pain twice. So yes, do them all. If you have to get them, just do them all. How I would rate the pain from day 1. Day 1 wasn't the worst. 3 through 6 has been the worst. It progressively got worse. In the beginning, I was like, oh, it's fine. I should be back to normal by day 3. Day 3, my jaw hard to open, all that good stuff. But I wasn't in throbbing pain. So I think that's really what it comes down to. That constant pain afterwards, the healing process, is really the worst part. So if you're not ready to be in constant pain, don't do it. Overall, I wouldn't say it was a bad experience. I just wouldn't want to do this again. So if you don't do them all at once, there's no point of doing them to me. I'm not a doctor, of course, but take whatever suggestions that your oral surgeon gives you, but or dentist as well. But it was recommended for me to get mine done due to one decaying, and it causing me some pain. So I had a cavity in one, and it was also hurting because they were coming in intermittently, not every day, just like there was 2 days back to back that it was causing me pain, and I was like, okay, well, we can get these bad boys removed right now. So yeah, all in all, would I recommend this? Yeah, do it, but all at once. Yeezys by Adidas, socks by Adidas, tights by Gymshark, top by Gymshark. Sponsor me, baby. And that's the fit of the day. See ya. Bye.